Hi everyone, thank you for joining us today. Today we're joined by Cara Camiolo Reddy, the Interim Associate Chief Medical Director for our Shared Clinical Services, to discuss how Intermountain is caring for our employees, also known as our caregivers here at Intermountain. Cara, thank you so much for joining us. We really appreciate it.
Thanks, Amanda.
So what do you do to help your teams and colleagues as they care for patients during this time?
I think the most important thing for us is to stay connected. And so some of the things that we've really made habits, such as daily huddles, have become increasingly more important as we try to share knowledge and also share experiences with each other. And so on a daily basis, making sure that we're connecting with our caregivers, we're listening, and then also as we're learning, making sure that we're sending frequent updates to them with new information. The more we can stay connected as it relates to our work, but also as it relates to just each other and our own well-being, is increasingly important in times like this. And so also making sure that, we have information out to them regarding their own wellness and mindfulness and exercise and yoga and things that they can potentially do in their off time or when they're home with their families to make sure that they're taking care of themselves and connecting on those reminders as much as we can.
Yeah, I think that's super important to have some sort of way to kind of turn off your brain too with the exercise or some sort of meditation that you do all the time. And it's great to hear that as a leadership team, you guys are really taking that into consideration for employees. So how are you also helping them cope and forgive themselves, take time for themselves and their family? I know shifts can be very hard and daunting depending on what happens that day. What are some things you guys are doing to help that?
Yeah, that's a great question. A couple weeks ago, we sent out something from our caregiver support team called the Going Home Checklist. And as soon as I saw it, it resonated with me, and I sent it out to my teams. And probably the reason it resonated with me was because I needed to do some of that myself. And on that checklist, one of the first things it said was just acknowledge something that didn't go as well as you thought it was going to that day, and realize that that's okay, and it's okay to let that go. But also take time to acknowledge 3 things that went well, and congratulate yourself for that, and really connect with the things that are going well. Oftentimes we can lose that in days that are harder or longer than we usually experience. And then also taking some time before you leave to get back to that concept of connection. Connect with your colleagues, reach out. Are they okay? And that shared experience that we're going through right now is really powerful for our caregivers, for each other. And so taking that time before you go home each day can really help to level set the experiences we're having. And then, having time to just let things go yourself and take a moment before you walk in the door and just turn off, work, and allow yourself to recharge, allow yourself to reconnect with your family. We also know that sometimes home right now is also challenging. Many of our caregivers have young ones at home who are out of school and loved ones whose, our usual routines have changed. And so understanding that we need to take care of each other, take care of ourselves, as well as our families, is an important point to remember. And, on that day where I got that email about the Going Home Checklist, must have just hit me at the right time too. And when I sent it out to my colleagues and my caregivers, I was surprised. It was probably the thing that I've gotten the most response on in the last several weeks, because we just sometimes need that reminder that, check in both with yourself and with each other.
Yeah, you brought up a routine and how that's been it's changed a lot from what I'm sure we're all used to. I know that I'm working at home and my significant other is also at home now, and we're not used to being in the same place for so many hours together.
Right?
And it's learning how to also give yourself your own time, saying like, hey, you should go on a hike by yourself. I need some space, or whatever it is that you guys need to work on, whether it's your significant other or your kids or just yourself, even going outside for 15 minutes a day to just take a deep breath and remember
That's
that
right.
like eventually this will be over and eventually you'll be able to get some of that normalcy back, I think is really important.
Exactly.
So you talked about how a lot of our caregivers are also now working from home too. Can you talk a little bit about how we're placing people who are experiencing less work at this time? We've discussed a little bit about redeployment and what that means within Intermountain, but I think it's good to explain to people outside that we're redeploying people to areas of greater need. And how are you supporting them in these unfamiliar roles right now?
Yeah, thanks for that question. It's a lot of the work that I've been focusing on the last several weeks. And what we're trying to do is understand that while there may be areas of our work where we've seen decreased volumes, as we've really focused on opportunities to physically distance and keep people safe, there are also areas where we've really started to prepare for potentially increased volumes. And our caregivers may have to shift their work too, so that we can support the work happening in our hospitals as volumes potentially increase. We've done a lot of learning from our colleagues that have gone to New York, lessons learned, what can we do, how can we best prepare? And so those are really helpful conversations that we're having as we think about some of the work ahead. And I will say, as I've really done, worked with a lot of this in the last several weeks and talked to my colleagues about opportunities to potentially redeploy in settings where they don't usually work. I will say there's a kind of put me in coach kind of a attitude that people have right now. Everyone really is willing to step up and help in any way that they can. Even with that enthusiasm, it can be daunting as a provider to step into a situation where you don't normally work. If you typically work in an outpatient setting and we're having you take care of patients or work on a team in an inpatient setting, even if you've had some experience doing that, if it's not part of your day-to-day routine, that can be difficult to think about. And so we're supporting them through making sure that they can be redeployed with peers who can really oversee and help work as part of a team. Also looking for opportunities to do what we call just-in-time training. Again, many of these providers have done this work before. It just may not be part of their usual day-to-day routine. So making sure they have, the tools necessary to be successful in that environment. But we also want to be sure that all of our caregivers are supported in learning every day about how we can best take care of patients. And so making sure we're staying connected with emails, with huddles, and on our teams is increasingly important. But we have a great system to be able to do that, and a great set of caregivers who are collaborative and really have that team spirit. So I think the support that we have going forward will really buoy the work we have ahead. And also getting back to a lot of the resources we talked about. As we think about what's ahead, there may be times where providers are busier than usual. And so making sure that we are reminding folks to take time for themselves and make sure that people are having days off when they need them and being mindful of scheduling. And so those are the things that we want to do to continue to make sure that we're supporting all of our caregivers, physicians and advanced practice providers and nurses and therapists and all those folks who are on our front lines.
Speaking of front lines too, I know a lot of our greeters that are greeting you when you walk in the door, screening you when you walk in the door now. That's not typically what they do every day. And I know they went through a little bit of training. Can you talk a little bit about how that position was not created, but came to be, and who some of those people are? Like, what positions did they used to have, and now they're doing greeting you and making sure that you're safe when you come to the hospital?
Yeah, all of our facilities are safe places to be, and we want to be sure that when folks are entering our facilities, they are understanding of some of the new perhaps rules and guidelines that we have for patient safety, for caregiver safety, and for visitor safety. So having folks at the front door to be able to greet you and talk about, here's what you need to do to be safe as you enter our facility has been really helpful for everyone coming in. Our doors are still open for patients, and we're still seeing folks in many of our outpatient clinics, as well as obviously in our hospitals. So having those greeters there is a really important step to make sure that folks feel supported when they're coming into our facilities. That position obviously is not one that we have usually, and we have pulled folks from some of our outpatient clinics. For instance, some of our front desk staff that usually work in our outpatient clinics may be at those desks. We may even have, in some instances, some of our physical therapists or physical therapy aides who typically work in our outpatient settings, but have some time to be able to work as that greeter as you're coming in. And so we're having folks who, again, to your point, don't typically do those jobs and perhaps usually work in a different role, but we're realizing that we have opportunity to make sure that we're connecting as folks come in. And the caregiver role that you described as that front-facing, front desk person as you walk in, that greeter, is a really important one.
Yeah, it's the person the first person you see, the calming
Right.
experience that you hope to have when you go to the hospital as well. Also, what's important for caregivers on the front lines to know about this pandemic and during this pandemic? What is the one thing that they should really think about right now?
I think the main thing to remember is, hospitals are safe. Our clinics are safe. And we're doing everything we can to keep both our caregivers and our patients and those in our community as safe as we can. Our guidelines for how we have really focused on things like the greeter to make sure that folks feel connected when they come in has been important. But I think the most important thing that I think having folks remember is that we're here. Mm-hmm. We're open for business, and we don't want folks who need urgent care to not seek that out because they feel it's unsafe. We're still here for folks who need care. We're still seeing folks in our outpatient clinics, and we encourage folks to make sure that they're connecting with their providers if they need us.
Yeah, you bring up a really good point. We talked a little bit during our Facebook Live on Monday about the need for urgent care and the fact that it's still very important. An urgent need is still that. And it might seem scary or a little unsettling to go to the hospital right now, but in the long run, for your own health, if you need care, it's best to do it now. And our hospitals are safe. We're set up to make sure that you receive the best care in the safest way possible. So along those lines too, if you could give a notice to our patients and our community members about the caregivers that are working right now, what is something you want them to understand about what these caregivers are going through, and not to sympathize, but to help them better understand where they're coming from when they ask these maybe random questions at the door?
Right. I think the main priority is everyone's safety. We want to keep our community safe. We want to keep our patients safe. We certainly want to keep our caregivers safe. And so when we have these new things in place, like the greeter at the front door, it really just is to reinforce that message of safety and make sure that when we talk about things such as physical or social distancing, that we're also making sure that we're doing that in our facilities. And so when folks come in, making sure that they understand the recommendations that are coming both from our organization, from our partners throughout the state, and certainly from the state itself, and that we're consistent in making sure that we are socially distancing appropriately, and that when folks need us, we're here for them. If there's a question, please call your provider. Please call the clinics. They're happy to answer questions if you have them. And again, if it's something that can be done virtually, where a provider can connect with you online, we'll do that in order to maintain that safety and that social distancing. But if it truly is something that requires you to be seen, we're here for you.
I think it's also really important for the community and our patients to understand that our caregivers are going through something that no one has really gone through before. And if they ask you a question that might seem unsettling or out of place, maybe take a step back and remember that they're also in this weird situation, and not to think that they're asking you a question to get like a bad reaction from you. They obviously want to help them. Our caregivers' main thing is to help you. So I think that's important. If you do need to seek care, just remember that they're probably had a very stressful day, a stressful 2 months, and just to take a step back from maybe what they're asking you, to think about your reaction towards them as well.
I think that's true of almost everything happening right now. This is a different time that really none of us have experienced before, and we're all learning as we go. It gets back to that notion that we talked about before of, just acknowledging that this is difficult, and that's okay. Mm-hmm. And sometimes that means we just have to take a moment. We remind ourselves of that on our teams every day. This is stressful at times, and despite our best efforts, it's okay to feel stress and to acknowledge that. The same that we're experiencing perhaps in some of our hospital settings, many of us, may also experience at home or in other settings as well. This has been disruptive, to say the least, for many people and for many people's lives. And knowing even within my own family how this has caused disruptions. I have family members in different parts of the country that are unfortunately have seen more effect of that than we have seen yet in ours, and hopefully we don't have to. Mm-hmm. And just being mindful that, everyone is going through something a little bit different, acknowledging that, that's okay, and giving each other time and space, and again, getting back to that notion of connecting.
Is there anything else you want to tell our caregivers and reassure them about what Intermountain is doing, and not only for them, but for the community at large too?
Yeah, that's a great question. I think what's most important first is to acknowledge that there is some discomfort, but also know and be reassured that we have an amazing group of caregivers here. And we have thoughtful leaders who are talking almost every minute of every day about caregiver safety and patient safety and how we help our community and to support them. And there is a spirit here, I'd say, both within the organization, but also in our community at large, that is really special. And I think one that allows us to continue to learn, continue to understand, and do this work together, that I find very reassuring. And I think as the days and weeks ahead, continue to present some challenges that we haven't experienced before, we have a wonderful community of caregivers and a wonderful community around us to help support that work.
I agree with everything you just said. Cara, thank you so much for joining us. We really appreciate it. And a couple of those resources that you talked about are also available to the public. We have an emotional health relief hotline that you guys can call. It's available 7 days a week from 10 a.m. to 10 p.m. And that phone number is 833-442-2211. If you feel like you need to talk to someone and just get some support and advice, it's a great phone line to call. We also have our COVID-19 hotline that you can call if you're experiencing mild to moderate symptoms and would like to find out about testing. That phone number is 844-442-5224. Thanks, everyone. We'll see you next time.